Najgorzej było wpaść w atak paniki. Wtedy bez...
Panika była?
Tak, jak pojawiła się hiperwentylacja wywołana przez stres, no to wtedy to tak, no... Zdarzyło mi się kilka razy tylko, ale wtedy to... ciężko było bez inhalatora.
Do you remember your first time when you have received an inhaler?
I don't remember exactly the first time, but I suppose it was somewhere when I was 14 years old, and it helped me much.
Do you think you're doing inhalation right?
I'm not sure. I suppose I'm doing it wrong because nobody told me how to do it exactly.
Are you doing inhalation right?
Definitely I don't know. I'm just take it.
People with asthma or COPD, their daily schedule depends on the medication intake, and those medications are crucial for the whole treatment of asthma or COPD.
During the design work, I concluded test our prototype device with asthmatic patients. Many of them inhaled incorrectly despite using inhalers the most of their life, and it was surprising for me, for these people, but they wanted to know what they done wrong. They wanted to try make a good inhalation and try again. Can you use?
My breath was too short, and the strength of it was too high, but the activation time, so the time I have taken my breath was optimal.
Wdech robiłem przez sekundę z siłą litrów na minutę. 360, to za mocno. Wow. I moment wciśnięcia prawidłowy. Czyli wkładam za dużo serca i za mało czasu w moje wdychanie.
Myślisz, że coś takiego pomogłoby Ci łatwiej zrozumieć i nauczyć się, jak zrobić dobrą inhalację?
Szybkie, łatwo i przyjemne. Z racji, że jest odniesienie do wyników, bardzo łatwo odnieść się do tego, co robię źle. Działanie w ciemno na podstawie wyczucia zajmuje więcej czasu, a w odniesieniu do wyników po prostu to jest zerknąć 10 minut i jest.
Good morning, and welcome to this very special event. Today is not only a milestone for our company, but also an important day on the global health calendar, World Asthma Day, with a theme that is closer to us than ever: asthma education empowers. At FindAir, we deeply work on problems of data gathering around inhalation devices. Our medication monitoring sensors are widely used around the world in top research institutions, pharmaceutical companies, or remote health services. But today, we will present you a completely new, revolutionary device that will change the dynamics of respiratory disease education forever. And what we hope for is to push innovation forward in the whole industry. According to the World Health Organization, asthma is a worldwide problem which affects 339 million people. COPD does not lag much behind, with 212 million cases reported globally, and those are not the only severe respiratory illnesses. What connects all of those medical cases is that they all rely on inhalation devices to manage their symptoms, whereas pressurized metered dose inhalers, commonly called pMDIs, are still the most popular and widely used type of inhaler in the world. We've seen a lot of innovation happen around substances, but not really in the space of inhalation devices and how they are used in real-life scenarios. Many decision makers seem detached from problems that people with inhalers are facing outside the clinical, well-controlled environment. Even though pMDI is the most popular drug delivery mechanism in respiratory treatment, the effectiveness of pMDIs is often compromised due to the incorrect inhalation technique. Even 86% of patients use metered-dose inhalers incorrectly, which means that up to 86% of patients are not receiving their intended drug dose. This can have huge implications for patients as well as for the whole healthcare system. It's been proven that hospitalization is twice more likely for patients with incorrect inhalation technique. It is just natural to ask, why invest so much into new treatments when you don't even know if people are taking their medication correctly in the first place? This is why we are proud to present a new quality in the pMDI treatment, the FindAir Smarthaler.
A lot of innovation is happening right now in the world, but the inhalers are still the same. We as doctors want to be informed how patients are using their inhalers and help them to use it better. Asthma education empowers not only patients, but also us doctors. The inhalation technique is hard, but it can be learned. I believe deeply that this device will change how we approach inhalation.
Creating a device that is that small and compact is a challenge when you think about analyzing inhalation flow. That is why we have developed flow sensing technology, an AI algorithm that can register inhalation flow with minimal space requirements and no interference in the flow path. Smarthaler is equipped with our AI flow sensing technology, which is performed on the device itself and allows for real-time inhalation feedback. Bluetooth connectivity enables the device to send the data directly to your phone or to your doctor. Rechargeable battery that works for 30 days, even when you use it couple times a day. Canister sensor enables the device to detect if the bottle is inserted correctly and ready to use.
Smarthaler is a versatile device that aims to upgrade the quality of everyday care. FindAir Smarthaler will be introduced as a Smarthaler trainer, an educational tool to teach your patients, loved ones, or yourself the mechanics of correct inhalation. That is why we are releasing a whole inhalation training station for healthcare providers, pharmacies, and schools. But you can order it also as a personal device. This will be especially useful for people with children starting their journey after asthma diagnosis. Don't miss out and pre-order your Smarthaler trainer today and bring the future of inhalation therapy to your community. And that's not all. We understand the challenges of pharmaceutical industry. That's why the Smarthaler device has been fully developed as a complete drug delivery device and it's ready for market implementation. We have tested and compared our device in external certified laboratory with one of the most popular two-substance combination products and proved its delivered dose uniformity as equivalent. Also, extending your inhaler experience should be always an option. And electronics shouldn't be thrown away when you empty your medication. We have designed an inhaler to be modular, so it will be easy to replace an actuator when needed. But also, Smarthaler drug delivery device can be sold as a standalone inhaler, with the option to extend drug dispensers with the FindAir Smarthaler module. Today, Smarthaler is a complete and fully working inhaler ready for implementation, but we plan to deliver inhalers for single, double, and triple substance drug delivery purposes with the whole range of orifice diameters. So, if your company is looking for a smart inhaler device, let us know. We are ready.